Hello, I am Jorge Bermudez. I am a medical doctor with a PhD in public health. I work at the National School of Public Health of the National Cruz Foundation in Brazil. I also work at the PAHO in Washington, Geneva, also in a joint initiative with Brazil, Chile, France, and the United Kingdom on access to medicine and purchases for low-income countries. I was vice president of department in Fiocruz. I am also a researcher and professor at the public school. I am very glad to be able to provide you this talk about my experience and how we see the question of global health, current trends, and the high-level panel of the United Nations on access to medicines. I participated in a very hard year of work, and I will also provide you some information on that. Initially, I wanted to remind and to recall that we are always working in the context of health versus trade or commerce, because it is that the price of medicines is so high today. So we can start with the lack of equality in the access to essential medicines. The WHO estimates that 1/3 of the world population doesn't have access to the right medicines. In Africa, 320 million of people lack access. And the problem is very serious in poor countries. And we know that funding for global health has gone up. It is increasing year after year, but there is a tremendous gap in terms of funding. There are not enough resources in terms of global health, and especially in the area of medicines. And this is, of course, a global challenge for health. Medicines are in the north, and the patients are in the south. So United States, Europe, and Japan are responsible for the use of medicines in the world. 80% of the world population is in developed countries, and more than 93% of the disease charge, and less than 11% of the global health in salute. That you see that this is not egalitarian. The pharmaceutical market, there is an expectation everywhere that it is $1.3 trillion, the expectation of the world great pharma. We have global diseases, hypertension, heart disease, diabetes, so the market is interested. And also we have those diseases that are not attended. They are forgotten by the great pharma. And also we have the diseases that are neglected, and the most neglected one, in the case, for example, of Africa, there is a disease, it's a poor population, a poor country, and the industry is not interested in providing the medicines for the diseases they have. And there's also a market of products that are not medicines, that also occupy a great part of the pharmaceutical market. For us, access to medicines is a fundamental human right. And we have some background information. 1948, the Constitution of the WHO, and also in 1948, the Universal Declaration on Human Rights. That means to say that medicines are a fundamental right, the same as the right to health. In 1966, there was an international agreement on economic, social, and cultural rights. And also there is a resolution of the Council of Human Rights of the United Nations emphasizing that need of fundamental rights. Access to medicines has to be dealt with as a human right, as a fundamental human right. We have to remember the fundamental rights, global health and access to medicines. In the area of access to medicines, the proof of the access consists not only in the existence of a service, but in the relationship between the need of medicines and the supply of medicines, in which the need is satisfied in the moment and in the place required by the patients, that is to say, the consumer, with a guarantee of quality and sufficient information for adequate use of those medicines. This access, quality, and rational use of the medicines, that has to be included in the notion of access to medicines. And regarding the medicines policies, there are a series of stakeholders: the pharmaceutical industry, the three powers of the government, legislative, users, communication, mass media, and health professionals. So in order to have a policy and discuss the policy, we have to take into consideration those stakeholders that they many times have conflicts among them. And recently in the WHO, the question of access to medicine is being discussed, especially the barriers that we find in the access to medicines, since the Commission of Intellectual Property Rights, Innovation and Public Health in the year 2003, there was a report was prepared, which is available. Then we have an intermental working group in the year 2006. They work very hard continuing the discussion on public health and intellectual property. Then we have two commissions: the expert group on research and development, and then we have the consultative expert working group on research and development. Two very important reports: research and development and everything that refers to the demonstrations products showing that it is possible to organize something well in developing countries without taking only consideration what the industry posts. So this process has been very rich in the last 15 years, since the year 2000 to date, with several moments, reports, resolutions of the Assembly that are being incorporated in the agenda and have to be discussed when we refer to access to medicines. I wanted to tell in which context was established the high-level panel in the United Nations. When the proposal was formulated by a high-level panel, we have a publication at the end of last year, which is New Drugs, Who Can Afford Them? For example, regarding the new antivirals for hepatitis C, and we had a affirmation. The CEO of Bayer in 2014, he said, "No, we don't develop that product for India. We develop that for Western patients that can pay for it. It's an expensive product which is oncological." This was a cancer product. So if we are to think that this product was developed by the laboratory and was marketed and traded in at $5,500 per month, and in 20% there was a compulsory license of the Indian authorities, which was conferred by the Supreme Court. In this compulsory license, instead of paying $1,500, it was manufactured by generic producers by $175 per month. That is to say, from $5,500 to $175. It's 3% of the buyer price for the production of the medicines, paying 6% of royalties to buyer. So that spirit of greediness of the pharmaceutical industries cannot be acceptable. And from that moment, I see that in that context, it is important to it was important to have this high-level panel. We have three on the slide, three bulletins or journals of great circulation from three rich countries, and they say that they cannot pay the price of the product for hepatitis C. And this was marketed by the Great Pharma at $84,000 for the treatment of 12 weeks. $1,000 each. We cannot pay for that. And the United States, a product that can save lives for hepatitis for $1,000 each dose. So the subsidy for hepatitis C was rejected. We have also the prices for medicines for cancer. All the new products have a very, very high price, $100,000 per patient. This, nobody can have access to these prices. So we see again the United Kingdom and the United States speaking about the high cost of cancer products, and it is impossible to absorb them. We also have old products which are very expensive too, because it is a challenge to the lack of innovation. A 2-year treatment including 8 months of daily injections, 20 months of treatment, and they have a collateral effects, psychosis, loss of the ability to hear. So at the cost of $4,000 per patient per year. It is also more expensive than antiretrovirals of the second line. These old products require innovation. In that context, with cancer medicines and antiviral for hepatitis medicines with very, very high abusive prices, with compulsory licenses, it can be produced 10 or 20 times cheaper. In that context, we have the access to medicines that has to be taken seriously. In September 2015, all the member countries, with taking into consideration the goals of the millennium and sustainable goals, the Agenda 2030 was adopted for sustainable development. The goal is health, and in health we have access to medicines, health at all ages, the health as a right, and ensuring health being addressed as a priority. 2 months later, the Secretary General Ban Ki-moon said that there were 14 members, appointed 2 former presidents and 14 others as members of high-level panel on access to medicines. And that panel, I have the honor of being one of the 14 members. We have the website of the panel with all the material compiled during a year of work, all the contribution, public audiences, anything, the positioning of several personalities, letters received. That means to say 1 year of work of the panel working very hard. The first question is, what does it mean that access to medicines changes from the WHO to become a clear and crucial question, not only of the Health Agency, but in the center of the United Nations? The recent discussions and the process between 2000 to date and the pressures of the WHO for those countries that do not want to discuss intellectual property, access to medicines as a human right. There are many questions involved, and therefore I think it was a great step to take it to the center of to the core of the United Nations. Who is giving the rules and who is financing? There was a crisis in the WHO with a lack of resources, and at the same time we have other forces, the bilateral cooperations, the foundations, the Gates Foundations, which became very important in the area of health, the World Fund that has resources and helps developing countries, and other players, foundations, the industry itself. In 2012, there was a commission in AIDS proposing a high-level panel to discuss a different model of research and development on intellectual property in the area of AIDS that could be extended to other areas. On the other hand, everybody is discussing access to medicines. The WHO, the WTO, the UNAIDS, the Program of the United Nations for Development, and Vatican itself have forums discussing access to medicines as a priority question. The possibilities, the mandate given by the Secretary General, the expectations of the panel, the expectations of society, and in the note that created this high-level panel was the 2030 Center for Sustainable Development is an aspiration to leave no one behind. That means to say everybody must enjoy access to medicines. The third mandate of the high-level panel was finding solutions for resolving the political incoherences in the context of health technology, the rights of the inventors and human rights and public health, and some trade rules. How can these problems be cured, these incoherences be cured, and among all these aspects? This is a great challenge indeed. And there is the members of the panels are discussing all these topics. There is an advisory committee, and expert group to provide technical support to the high-level panel so that the panel can do their duties on the public audiences. One in London, another one in Johannesburg. There was a call for everybody may contribute with the necessary contributions. There was a call for the public contributors. There were several meetings and dialogues and hearings, and the contributions based on evidence until the final report. In that process, 182 contributions were received, most of them from the civil society and groups of patients, also from the academia. We have the private sectors, governments, and other independent and international organizations. A total of 182 contributions with concrete proposals for increasing and ensuring access to medicines in the area of health. This was a very rich process. We also had contributions from intergovernmental organizations and the Organization of the World Intellectual Property, the UNIDO, the WTO, the High Commissariat on Human Rights. All these bodies contributed with documents and concrete proposals in order to resolve the gaps among those areas in the area of health. We see two pictures of the meeting with a very open dialogue, also with contradiction. There was agreement, but also there was disagreements on many aspects. This was a joint meeting of the members of the panel with the advisory committee. So we had several meetings in London. This is from the lady is the former president from Switzerland, and in all the audiences in the public function there were manifestations of civil society in the area that we were working, and these dialogues were accepted and they were incorporated in the documents, giving value to the voice of civil society. Here we have some pictures of Johannesburg from 17 March 2016. There were also manifestations in the street during the public audience. These were very rich moments, and the outcome was the report that was released in September 2016 with the findings and the recommendations of the panel in order to promote access to medicines. 1 year after the report was disclosed, The Lancet had an editorial says status quo is no longer an option. So, with this report, there was a report of the Secretary General. Since today we cannot maintain the status quo, and there was also pressure on the oppositions, that especially the great pharma, to continue the work of the high-level panel. So let's see the recommendations of the high-level panel. Findings in the report, but the most important would be to transmit the recommendations of the panel. There are several areas: intellectual property and access. The members of the WHO must use Article 27 of the TRIPS Agreement for real innovation in order to improve the situation of patent all kinds of patents, because sometimes they don't comply with the requirements of a patent. Strengthen patents in our country. If there are patents, they have to be real ones. The governments must adopt and implement legislation facilitating the issuance of compulsory licenses, which are a right of the countries, and as well as the countries have the obligation to comply. Also to review and revise the Doha declarations regarding the exportation of products, because it was not possible to comply with the provision of this declaration. So it has to be revised. Governments involved in commercial negotiations should not challenge the right to health with TRIPS plus measures, because this has been usual. In the case of bilateral regional agreements or multilaterals, they use the TRIPS provisions and they affect the area of health. And governments also must assess the impact in health before accepting agreements of trade and investment, because this may provoke negative consequences for health. With the research of public funds, it was very clear that the knowledge created with public funds must be free and available in literature with the revision of the peers. The universities and institutions of research must prioritize purposes of public health, and the use with public funds must have results in the area of health. Regarding the new incentives for investigation or research and development, there must be partnerships, PPP, and also for productive development, strengthening the public and private sectors and also the philanthropies, and also innovative mechanisms have allowed investment in priorities of public health. The report has a lot of very detail. This is just a very quick summary of the report. Another recommendation is that binding treaty, the linkage in the cost and prices, what is invested in research, has not to be translated to the prices of the products, because if they are very expensive. And which is the difference between cost and price? Which is the real cost of the medicines? There must be a code of principles, and the WHO has a role to have in these questions. And also, transparency is a very clear question at all moment. Investigation and development, production, in marketing and distribution of the products, in addition to accountability and the role of governments, civil society, and the General Secretary of the United Nations. And also, in the area of governance, we have to have data of clinical essays, databases with WIPO, and so on. I wanted also to mention a question that is very serious. What I think the discussion was missing. There was no consensus because there were diverging positions. For me, the current service has failed because there was no consensus. And since then, we have to see what we can propose. So we have to recognize that in some cases there was a failure. We have to have concrete proposals at the short, mid, and long terms to as a remedy to a system that failed, proposing a new regime of intellectual property for pharmaceutical products consistent with the international codes of human rights and requirements of human rights, safeguarding the rights of invention. For us, this is very important in order to discuss and propose a new regime for intellectual property for pharmaceutical products. On the other hand, countries must be free from pressures when using TRIPS flexibilities, including the decision of a patent criteria. For example, the discussions between pharmaceutical companies against Argentina or Brazil. On the other hand, in my opinion, the plus TRIPS in free trade agreements must be suspended immediately and must be prohibited. They had to be banned. Voluntary versus obligatory measures have to be clearly stated. And the compulsory licensing is a right of the countries. So the right of the countries should be respected when implementing their own legislations. There was a proposal also with the Global Health Committee of the International Law Associations that said that essential medicines should effectively automatic compulsory license for essential medicines. We discussed a lot the model list of the WHO for essential medicines. And from that, each country should be able to have their own list according to their own needs and governmental decisions. This was raised. They didn't want to discuss this topic because there is a strong opposition of countries and of the industry to have a compulsory license automatically. And they had barriers in the area of compulsory licenses, but this is a discussion that we believe this has to be a center of discussions in order to provide the countries the possibility to advance in this compulsory licensing. Automatic one, having the first module of essential medicines. Also, strengthening the legal role. And when this was being discussed at the high-level panel, this was also they were also discussing the case of Colombia. Imagine if Novartis, and there were also threats to Colombia. For us, this was not acceptable. We cannot accept that to have gains trying to when a product trying to avoid compulsory license in a product. And when it was clearly proposed to the panel, it should be highlighted in the report. But this is a very recent case. It's being discussed, but we think that should have been discussed a little more. Which are then the next steps to be taken to clarify legal implications? For example, the consistency of proposals with the TRIPS agreement and the consequences of the measures proposed, having a dialogue with the WTO, the WHO, maintaining the debate in all the possible forums in order to attract the discussions and debates. And also implementing a recommendation of the high-level panel and promote indicators of the Lancet Commissions. Regarding the recommendations, there are concrete ones that has to be implemented. As regards the Lancet Commission, there was a report in December 2016. They approved a series of indicators that should be added to some extent, working those two reports in common, and also to potentialize the ability and capacity of mobilization and production in our region. Our region is a very rich one in terms of productivity, and we have to maintain this permanently, guaranteeing access to medicines, which is a fundamental human right. And I show you this image of South Africa with the Mandela thought. Health cannot be a question of income. It's a human right. And that is how we have to address it and respect it and promote it. Access to medicine for us is a fundamental human right, and that is how we have to work on that. Access to medicines as part of the right to health, a fundamental human right, again, and a social question, and never a commercial question. This is the thought that I wanted to bring to you, so we could think together, knowing that we are working very hard to be able to promote the right in the countries of our regions through social movements, civil society, governments, the academy, think tanks, professors, because for us this is a fundamental question. It has been a great pleasure for me and satisfactions to be able to provide you with these thoughts on human health and access to medicines. Thank you very much. Good afternoon to you all, and my greetings, the participants of this course organized by the ISAGS. I am Angela Acosta. I am an expert in medication and health technology at ISAGS, and I am going to provide a brief description of the main actions and characteristics of the structure and operation of a group of actions of medication of UNASUR. GAUMO is a group of access, universal access to medicines. They have made contributions and they make actions they are carrying out. I would, as I said, provide a brief description. I will not get into many details. Perhaps some of the people could give you broader description, but with the idea of facilitating the development of the course and explain some of the things that were not recognized. I will try to do it quickly and summarize and the description on the group of universal access to medicines, GAUMO of UNASUR. As you know, this group is part of the South American Health Council, and also it is the intention to implement many of the actions in health that were foreseen in the Health Council right from the beginning, and seeking the purpose of the regional health field, that is to build up integration spaces, in this case, of access to medicines, in order to provide common politicals and activities in which the country may have a contribution and participation. This description that you see here You may find it also on the UNASUR webpage on the definition and main characteristics of GAUMO. This South American Health Council is made up of 5 technical groups made up of other activities that are part of the course, part of this structure of technical groups. We have the group of access to medicines or medication. The GAUMO group was organized in order to develop strategies and work plan in order to improve access to medication in South America. And the results that were foreseen as part of the activities of the technical group GAUMO were those of strengthening the policy of access to medicine with the main purpose of strengthening productive capacities of the region. You will see that these main purposes were developed by the members of the GAUMO group right from the beginning, and also the formulation of proposals as the price policies, creating spaces of possibilities of exchange of information, inputs for the formulation of price policies for each country and also on a regional sphere, and the existence of spaces in which we could work in order to reduce barriers to access to medicines. For example, in the case of patents that may have an influence on medicines, on the area of medicines. All these results were worked out and developed, as I said, right from the beginning. Within the actions in health of the South American Council, we may see that 2 of these main actions have to do with activities that the GAUMO group was in charge of organizing. 2 of the main tasks that we may mention is the mapping of capacity, regional capacities and production of medicines, and the second is the price bank for UNASUR medicines. Since the year 2012-2013, we are working strong, and the group is working strong, and that the results is the consolidation of 2 of the 3 projects of common initiatives funds of UNASUR that are financed or funded today. In UNASUR, we have a fund which is the Fund of Common Initiatives that tries to facilitate the development of regional projects in the several areas. Within the area of health, we have the development of 3 projects, 2 of which are going to finish soon. One of them is the price bank of medicines, and the other one is going to be hired and executed, which is and this project was formulated in 2014, and it was and the ISAGS is executing the projects, and the group GAUMO have been working together with the idea of implementing the best way for the development, and this is one of the priority actions for all the member countries, the active members of GAUMO. And the general purpose of the project that is being funded to date, and we hope it will be implemented soon, is create information on the public and private capacities for the production of medicines, with the aim of contributing to recommendations for strengthening the coordination of productive capacities. The outcome of this project have a very important relevance, not only related to the recognition of the capacities, both public and private, but also to try to find possible solutions to problems that we have to face today. For example, in the lack of medicines in some countries in the region, some possible actions for mitigating the lack of access to medicines, high-cost medicines, because these prices are a barrier for the populations, and also access to medicines that, due to the termination of intellectual property rights and patents, cannot be purchased through conventional means. So this is one of the approaches that represents and the countries in which the countries are very interested. And we hope that with the development of this project, we will be able to have different options, providing the countries with possible interventions and scenarios in terms of offer and facilitation of access to medicines in our countries. The second project that was financed by UNASUR Common Initiative Funds was the Price Bank of Medicines. This project was formulated by the Gaumo Group, and since 2014 an agreement was signed through which ISAGS committed to implement the project. The project was developed until last year, almost 80% of the implementation, and as you may see, in the first phase, this bank intended to share and facilitate the exchange of information between governments on public purchases of medicines and the incorporation of medicines and new medications according to the needs of the party states. This project has a platform that is part of the infrastructure of UNASUR's General Secretariat, and the expectation is that it will be broadly used by the people in charge. The people that are in charge of feeding the platform and may have access for the information. The project also has a second phase, a second stage, for incorporating new medication and medicines. We hope that in this case, and the expectations of the countries was sharing informations in order to facilitate decision-making processes in terms of purchase of medicines. This is a project that it is very important because these sources of information are relevant for all the countries, and it represents a very important support to be maintained and updated by Gaumo and by all those responsible for the coordination of the project, so that the platform may have updated information, facilitating the assistance and also the inclusion of all the information from the countries on prices and medicines. This is really a challenge because this is a great effort from people in charge in order to upload the information and manage the platform. But this will also mean a prior effort. We hope they will have the mechanisms, the right mechanisms, so that the platform becomes useful in the decision-making processes in the area of prices and purchase of medicines by governments in our countries. From GAUMO, there are also several joint work scenarios with the possibilities of the process of joint negotiations for the purchase of medicines. This was useful so that some countries, for example, of the Mercosur, may continue with the process of joint explorations on negotiation of prices of some medicines that are very important for the member countries of Mercosur. On several occasions, the success of these sessions and of this joint work was disclosed, and all the operations that the GAUMO group has been involved. GAUMO has also contributed very actively to provide input to the declarations that are presented to the Health Council, and some of them were also taken to other global scenarios like the World Assembly, also PAHO, and within those declarations and statements we have those that have to do with access to medicines and the possible barriers to access, for example, in terms of intellectual property. And also there were statements related to problems like the lack of medicines in the region. Providing support to these activities of the GAUMO group, ISAGS, in addition to providing support at any time to the different purposes of GAUMO, and also being the organ in charge of implementation, ISAGS has developed a very important support during this year, taking into consideration the recent structure, and is the offer of specialized professionals in the area of medicines within the actions that are included in the plan of action of the ISAGS for 2017. For example, 3 main actions. The one that you see is the lack of medicines essential in the region. This is a study that was carried out with the inputs of all the countries, that was sent to the national coordinations in order to gather information and have a description on the problem involving the lack or the scarcity of essential medicines. They were also recognizing the problem, and together with other projects like that on capacities, we may identify and help the countries in these interventions that are favorable for mitigation these problems of shortage of medicines. Another action has to do with a study on processes of purchase of medicines at the regional level. It's being developed. It was very interesting to recognize these processes for public purchase of countries, and procurement, and how this process were developed by the agencies, the departments in the ministries. And the purpose of this study is to provide a photograph of the processes, allowing us to identify possible scenarios of cooperation, sharing experiences, and also potential scenarios that are not completely described, are at present being perceived by the countries. Some innovative experiences on procurement of medicines, and also to develop a virtual seminar on internet vision on the challenges represented by the incorporation of new technologies. With the help of Brazil and Colombia, technical areas, we will try to create a product allowing consultation to all those that were not able to participate in our seminars. And this will be a product that will be included in the 2018 activities. Also, we have emphasized the question involving the taking to justice of the question of access to medicines. We made initial recognition work in the area of health law, and we had the possibility of being coordination in two events, one in October in Sao Paulo was the Inter-American Congress of Health Law, with an active participation recognizing all these cases involving the taking into court of these processes in the area of health. And there were many papers presented, and the one in Brazil was justamente judicialization of medicines. There was also we participated in an international forum on health judicialization, and this provided us the possibility of having an initial recognition of the problem in the region, and also to formulating the next activities for 2018. We made a quick recognition of the topics of GAUMO, and which received the support of ISAGS. This group was one of the most active ones in the regional health area. And establish which are these tools that will allow us to identify those who are necessary in terms of the recognition of profiles according to each disease, and the situations in which we don't have any other option in the pharmaceutical area. Which is the strategic horizon involving the political agenda involving medications or medicines. We have the main strategic horizon, which are the objectives of sustainable development. We have objective 3, which you have seen in the course, and within, and we have the specific goals related to medicines and vaccines. 3.8 deals with the achievement of health coverage, which may seem opposite to the general purpose involving universal health system. But in the second part of this goal, we have a clear convergence with these global questions in terms of favoring access to medicines, quality and accessible for all. We have a total convergence of our South American countries that have to do with facilitating access to medicines and vaccines that are essential. In conformity with the Doha Declaration, which we have the agreements on public health and the TRIPS agreement, there is a clear convergence with our main priorities in this area in terms of the current situations and vis-a-vis the trade agreements in our countries. And the experience of our countries that have had some time of intention of applying these flexibilities according to the demands of the stronger efforts for establishing possible means for use flexibilities in the area of medicines in order to favor our situation of access to medicines and public health guarantees. In relation with these two goals, we could establish perhaps the UNASUR right from the beginning has considered in a very clear manner that access to medicines is one of the main strategies in the area of policy for the region. You will see there that we have as the main intention in the area of health to favor universal access to social security and health services, and that in practice member states show that health is one more rare sin. And for us, it is clear that this importance and priority of recognizing the regional possibilities for favoring universal health services and access to medicines, universal access to medicines. So this agenda, which was established since UNASUR was created, we have some steps that are being developed in terms of establishing productive units in the region, strengthening local pharmaceutical industry, favoring access to medicine through negotiations, international bloc negotiations, and also recognizing some problems that are specific of our countries that we don't see in the global area, but anyway they affect the intention of the regional policy regarding access to medicines. This we are measuring, and we recognize that in our countries we have the question of judicialization of medicines, taking the cases to court involving medicines. We are working as a strategy regarding governance in health related to medicines. And finally, I brought some documents in which I worked some years ago in relation to governance and globalization, and I would like to leave this to you as a final message of this class. Globalization and governance in health demand a practical place in order to see the model and the role, guaranteeing which are the states that are able, and those rules do not have to displace the human being from the central of concern, and less in an aspect so important and health is. This is the characterization of global, regional areas joint work in the area of medicines and pharmaceutical policies. And this was the intention, recognizing our sovereignty and our main problems in order to create the best sovereign interventions involving governance in health and medicines. This is the end of my presentation. Thank you very much for allowing me to be with you. And you will see in the last slide my email, which is available for whatever you need and exchange ideas. Thank you very much. Hello, good afternoon, dear colleagues, dear students. I am the director of the General Direction of the Professional Associations of Paraguay, and I have the privilege of working in this office since its creation, with a lot of experiences in global health, but always learning and hoping that this talk that we will be having will serve not only you, but I will continue learning things. I work at the Ministry of Public Health in Paraguay in the General Bureau of International Relations. I will tell you a little about the South American experiences within the topic of intellectual property and access to medicines. Also within this topic, we may also refer to the negotiation process, the joint negotiation process of high-cost medicines. I always say is the only way of showing real integration when we can demonstrate that the United States together may come to an agreement and benefit their own peoples. I will start this talk commenting that the purposes, the goals of sustainable development, the 3D goal, we must facilitate access to medicines and essential vaccines in conformity with the Doha Declaration regarding the agreements, the TRIPS agreements and public health. We are reaffirming the right of the countries to use the provisions of the agreements on the aspects of intellectual property related to trade as far as flexibility for the protection of public health is concerned, and provide access to medicine to all. In this topic, I've been working for quite a few years, and I was also Health Surveillance Director and the Regulatory Medicine Authority. As I'm carrying out studies, attending meetings, and under the focal point of the ministry regarding the norms. In the case of the INAPI is the Bureau of Intellectual Property in Paraguay. I've been working for a long time now in the acceptance of bilateral agreements in order to provide that these intellectual property treaties are not a barrier to the purchase of medicines. Access to medicines is a priority for Mercosur countries and the regional countries. And we cannot accept that abusive trade practice that we all know by the American industry principle may hinder the purposes of public health. The creation of an ad hoc committee for negotiating high-cost medicines in the party states of Mercosur and confirmed by UNASUR, I think that this would contribute to guarantee best prices for the region, ensuring that the purchase of these products can be negotiated jointly by party states. This was an initiative from the year 2014 when this commission was created. I will refer to it in detail. But in fact, this was due to the high cost of these products, especially those used for catastrophic diseases, monoclonal antibodies, and so on. During a meeting of ministers, the proposal of Paraguay, Ministro Barrios from Paraguay, this committee was created to see if together we would be able to achieve or get better prices in the case of high-cost medicines. These ministers of health signed a declaration in the regional area because they were concerned, because these trade agreements were obstacles for access to medicines and basic vaccines for the populations. Within the framework of the Mercosur meeting of ministers in 2015, there was an agreement signed approving the creation of the Committee for the Negotiation of Prices of Medicines, high-cost medicines, and this was conferred by the UNASUR party states in Montevideo, Uruguay. Of course, to approve the list of medicines was one of the main duties of this committee, because we should have common interests. This was a concern, really, and therefore we said, no, let's make a list of medicines that are high cost and of common interest in order to quantify demands of the countries and be able to present these demands with the common denomination, international common denomination, to the pharmaceutical industry. We also have to monitor the purchase process until these medicines are delivered to countries. The committee is in charge of negotiating prices with the manufacturers. The first experience was in Paraguay, where we organized the first meeting with providers that were present. Representative from several laboratories. Was very interesting and also gratifying, because we saw all the party states seated on one side of the table, and on the other side of the table all the pharmaceutical industry. Brazil was appointed as the spokesperson, but all the countries were together. It was very nice to see all the countries from the flags from our countries while we were negotiating with the industry. It was the first experience, and with medicines for hepatitis C. There was a negotiation minute with the result and the final price for purchasing these medicines. It was a great fight, though, very tough, but we were able to achieve the reduction of costs because the demand was higher and better prices were achieved with this, in view of these demands. Of little by little, better prices appeared. Then all these details were sent to the PAHO for them to serve as a reference prices for PAHO purchasing purposes to be negotiated by the states. And you will say, why PAHO? Because each country, of course, has their norms regarding the purchase of medicines, And at that moment, it was like a partner that was free to to pay for the cost of the medicines, because not all the countries are enabled to make international purchases. Each country has its own public norms, so PAHO became a solidarity partner, and as many of the countries have experience in the purchase of vaccines through strategic funds, why is it that we cannot extend this and do it also the same thing with these medicines? So the party states and the members of Mercosur and then UNASUR, because the Mercosur associated parties are also members of the UNASUR, they committed to adopt these mechanisms, and with this negotiation process it was possible to guarantee delivery and especially to avoid parallel negotiations, because the experience that we had, we also were able to see that each country, each laboratory was coming separately to say, no, don't buy together, buy from our laboratory. So there was a commitment for a joint purchase, precisely to guarantee that no parallel process would take place. Because in this case, with a joint purchase, the demand, the quantities were of course higher. And there was very medicines. There were also offers by the industry, because this was a pilot plan with the medicines for hepatitis C. These offers, how does it work? How does the committee work? The offers must be presented with a unit value to the committee, with FOB prices and in American dollars, which is the international currency. The industries must offer a sole price for all the countries, and the roof will be always lower than the price of the region. Many times we took the Brazilian price because of the large demand, which was also the reference price for us all. So it was used as a roof. And also the cost would improve. There were some norms that had to be complied with, ensuring the quality of the medicines. Therefore, the laboratories were obliged to comply with good manufacturing practices, and also we were in agreement to incorporate all therapeutical medicines that were similar. We know that the norms in therapeutical terms differs from country to country, but there is quite a similitude. The most important thing was to assimilate things, and the will of the ministers was to incorporate similar biotherapeutical, because they are very high cost medicines. These prices are managed confidentially, and the information is shared only between the members of the committee. What about the achievements? Very interesting prices, not only for hepatitis C, but also international retrovirals. We are also preparing a new list for negotiation of cancer treatment, especially with monoclonal antibodies. As you will know, these are high-cost medicines to a cancer. It's a catastrophic disease. We are all concerned with it. So I would like to mention also the relevance of the presence of GAUMO, which is the group of access to medicines of UNASUR, with the price bank, because all the party states are cooperating and updating the prices of the UNASUR prices. And this is very useful when we come to the table of negotiations in order to negotiate joint prices. One of the main products of GAMI, one of the main samples of the unit, is that it is serving our price bank. We are in a process of updating, and we have received from the pro tempore presidency to update prices. We have prepared, the countries have prepared the list, but it is always open to any addition or any medicine that might be of common interests among the states. The presence of GAUME is very important in this case. And also another topic that we will listen later is the question involving supply. GAUMO is really very important and is a very important tool for this committee regarding high-cost medicines. My conclusion, my personal conclusion, I think that it will be yours too, is that this mechanism has demonstrated to be a valid tool for improving the access of the population to medicines that are very costly. And the good use of our knowledge in the exercise of health diplomacy will ensure the continuations of good results. Because diplomacy in health is a negotiation process where we must know the tools that diplomacy provides in order to progress in such a rough negotiation. So with the industry, the big pharma, so sometimes we go forward, sometimes we go backwards, sometimes we are tougher. This is the tool that our diplomacy knowledge provide, which is very, very useful when we negotiate in all these processes and in the bilateral agreements and regional agreements too. For example, in negotiation plans with the European Union, Mercosur, there are bilateral regional experiences that sometimes we have to import the regulation from other region or country in the area of intellectual property especially, which is the most important one, in order to be able to use all these tools for negotiations. Finally, I would like to mention that the Union among the countries in the region will always have the necessary force and strength for improving the health of our peoples and reducing costs and improving the situation of the health in our countries. Thank you very much. Please let me know if you have any question. My contact details are at the ISAGS, and I will be glad to satisfy any consultation or any other experience you may know. This was a very valid experience for me. And I always know that when we are together, we are strong. Thank you very much.